Think about this for a second. There's a moment that happens completely quietly in the body over time, and honestly, most of us never even feel it. The daily medication you've been taking for years, literally the exact same pill your body has tolerated without a single issue, can suddenly start to behave very differently. And it's not because the pill changed, it's because your biological environment did. What makes this so deeply fascinating and absolutely crucial to understand is that this shift almost always happens without any blaring warning signs. There's no sudden pain, no obvious red flags. It's just this silent shift happening right beneath the surface, quietly transforming a perfectly normal daily routine into a hidden strain on your cardiovascular system.
It's a simple idea, right? The pill hasn't changed, but your body has. But in a lot of cases, this subtle biological evolution is not a small detail. It can literally mean the difference between cardiovascular protection and an unmeasured, stealthy increase in the risk of a heart attack or a stroke. We all naturally kind of assume that if a medication was safe for us a decade ago, well, it must still be perfectly safe today. But medicine is really all about context. So throughout this explainer, we're going to take a really close look at some incredibly common everyday medications that might just deserve a thorough heart health and stroke risk review as your body changes over time. Okay, let's dive into the actual mechanism here, because the how of this is absolutely fascinating. I want you to think of your cardiovascular and metabolic systems like a massive, highly coordinated city traffic grid. As we mature, the liver, which basically acts as your body's waste processing center, gets just a little bit less efficient at breaking down medications. At the same time, the kidneys, your primary filtration system, also lose a bit of their rapid clearing capacity. Because of this natural slowdown in the traffic grid, medications end up hanging around in your system longer. And over time, even a completely normal prescribed dose can start to accumulate. It starts acting like a much higher dose inside the body. To put that into perspective, just look at the contrast between a younger cardiovascular system and an evolving one. In a younger body, your arteries are incredibly elastic. They easily expand and contract to handle changes in blood volume or the impacts of different medications. But as the body changes, the inner lining of those blood vessels becomes way more sensitive, and the arteries themselves lose some of that youthful rubber band flexibility. So adding certain everyday medications to this changing system, it's a lot like routing heavy freight trucks through a fragile, older traffic grid. The roads simply cannot absorb the shock the way they used to. That brings us to our first category, which we can call the pressure builders. We're talking about very common things like NSAIDs and decongestants, and how they interact with that shifting traffic system. Let's walk through this biochemical domino effect. When you take a non-steroidal anti-inflammatory drug, an NSAID, for an aching back or a sore joint, that drug works by blocking the specific enzymes that cause inflammation. Sounds great, right? But here's the catch. Those exact same enzymes are also responsible for keeping your blood vessels relaxed and maintaining healthy blood flow. So by blocking them, your blood vessels subtly tighten up. Now let's say you add a decongestant for a seasonal cold. Those work by explicitly constricting blood vessels to clear your nasal passages. On top of that, NSAIDs can cause your kidneys to hold on to sodium and fluid. So suddenly, your vessels are tighter, your fluid volume is up, and your heart is literally forced to pump against a much tighter, heavier grid. The really tricky part here is the illusion of safety. The immediate relief you get from these pills effectively masks the long-term strain they're putting on your heart. You don't actually feel your blood pressure creeping up in real time. You don't feel your heart working overtime to push against that extra fluid. But daily, frequent, or long-term use of these pressure builders without a routine medical review, that can quietly accumulate into a very real cardiovascular risk. Now let's pivot to a different kind of challenge, hidden deficiencies and slowdowns. Specifically, we're looking at things like proton pump inhibitors and benzodiazepines. These don't build pressure. They create subtle systemic changes. You see, almost every intended medical effect has an overlooked systemic impact. Proton pump inhibitors, or PPIs, are amazing at reducing stomach acid and giving you relief from reflux. But long-term, unchecked use, it can deplete crucial nutrients like magnesium, calcium, and vitamin B12. And your heart absolutely relies on those nutrients to maintain a stable, healthy rhythm. Then you have benzodiazepines. They calm the nervous system, helping with sleep and anxiety. But as a side effect, they also slow down your physical movement. They alter your breathing patterns, and they can actually diminish optimal oxygen flow throughout your body. Let's dig just a bit deeper into those acid reducers. When long-term use of a PPI disrupts your absorption of calcium and B12, it isn't just making you feel a bit tired or affecting your bones, it can actually compromise something called the endothelium. The endothelium is this super delicate inner lining of your blood vessels. It is literally essential for letting your vessels relax and for controlling how your blood clots.
When it becomes vulnerable because it's starved of nutrients, your cardiovascular system's entire defense mechanism gets weakened. And those calming agents we mentioned, they present their own unique mechanical hurdle. Because older bodies process sedating medications more slowly, the drugs just hang out in the bloodstream a lot longer. The result is a pretty simple equation. People naturally move less, they sit more, and their breathing gets significantly shallower, especially when they're sleeping. Reduced movement plus shallow breathing equals sluggish circulation and lower oxygen levels. And in a changing cardiovascular system, sluggish blood flow is exactly what sets the stage for dangerous clot formation.
Which leads us right into the delicate balance of clotting. And a perfect example of this, low-dose aspirin. This is a wildly trusted daily habit that perfectly illustrates why context matters above all else.
Think about the biological trade-off going on here. For years, taking a low-dose aspirin every day was assumed to be a harmless, universally great idea to prevent heart attacks. It works by basically making your blood platelets less sticky, which stops clots from forming. And hey, for people who have a specific history of heart events, it is still incredibly protective. But as our bodies mature, our blood vessels naturally get a bit more fragile, and the protective lining of our digestive tract actually thins out. Because of those increasingly fragile vessels, the clinical guidelines have actually heavily shifted. Taking aspirin just in case, without a specific cardiovascular history to warrant it, means you might be thinning your blood at the exact time in your life when your body's risk of internal bleeding is naturally going up. In some folks, this imbalance can actually increase the risk of bleeding-related strokes, completely wiping out the clot-preventing benefits. It really requires careful one-on-one matching with your doctor. So, let's bring this whole physiological narrative together. We've reached the core issue: the accumulation effect and the danger of the add-on medication. 3 to 4. That's the number of interacting medications that so many people find themselves taking every single day as time goes on. Think about it. A pill for blood pressure, an acid reducer for the stomach, a sleep aid at night, maybe an occasional decongestant when the seasons change. Individually, every single one of those was prescribed with good intentions. But together, in an evolving body, one is raising the blood pressure, another is slowing the breathing, another is draining magnesium. And your body is forced to silently overcompensate for the whole shebang, all at once. And because this accumulation happens so gradually, the warning signs are incredibly easy to just brush off. You might think, oh, I'm just getting a bit older. But unusual fatigue, feeling a slight shortness of breath just taking the stairs, or having moments of unexplained dizziness when you stand up, those aren't always just the passing of time. Often, those are the subtle signals your internal traffic system sends when the medication burden is finally starting to overwhelm your heart and your kidneys. So, what do we do about this? How do we align our routine with reality and shift away from just running on autopilot? Well, here is exactly how you can take control of your long-term health. At your very next medical appointment, instead of just running through new symptoms, I want you to bring this exact question to your doctor or pharmacist. Is everything I'm currently taking still appropriate for me at this stage? That one simple question shifts your entire healthcare approach from autopilot to optimized. It forces a real review of the doses, the durations, and the combinations based on exactly who you are today, not who you were 10 years ago. Being a truly proactive patient means putting literally everything on the table during that review. Yes, even those over-the-counter pain relievers and seasonal allergy meds that seem completely harmless. Tune in and listen to the subtle changes in your energy and your breathing. And most importantly, embrace a concept we really don't talk about enough: safely reducing a dose, adjusting a duration, or stopping a medication under professional supervision can be just as life-saving as starting one. Now, a very quick but important reminder before we wrap up. This explainer is strictly informational. It's meant to spark a better, more informed conversation with your physician. Please never stop, start, or change any medication routine on your own. But absolutely take this knowledge forward with you. As your body's biological environment naturally shifts, you have to ask yourself, are your daily habits shifting with it? Or are you essentially running old software on a completely new operating system? It's a question definitely worth answering.